So the requirement for the growth, that is, as said earlier, carbon, nitrogen, sulfur, phosphorus. Nitrogen, it's amino. It's useful for the amino acids, for the proteins. So most bacteria decompose proteins. Some bacteria use ammonia or nitrate. A few bacteria use nitrogen as a mode of nitrogen fixation. Sulfur, it's also important for thymine biotin production. They also decompose proteins. Some may produce sulfates or sulfides, hydrogen sulfide as well. Phosphorus, it's a backbone molecule for DNA, RNA, and ATPs and phospholipid membranes. Further trace elements like iron, copper, zinc, so they are very much essential. So usually they as enzyme cofactors. The other important thing is about the oxygen requirement. Depending on the oxygen requirement, we classify these microbes in various types. Obligate, they must require oxygen. Facultative. So first we divide aerobics and anaerobics. Aerobics is they require oxygen for their growth. Anaerobes, they don't want oxygen. For the obligate anaerobes, oxygen is toxic to them. So anaerobes, aerobes, they are obligate aerobes. They solely depend upon oxygen. Facultative anaerobes, so they can live with oxygen, but their growth is enhanced in anaerobic conditions, like Streptococcus. They are facultative anaerobes. Obligate aerobes, good example is tuberculosis, Mycobacterium tuberculosis. Obligate anaerobes, they are termed anaerobes, they grow well in anaerobic conditions. There are bacteroids, fusobacterium, Streptococcus. There are a lot of organisms, but problem is we can't detect these things very much. And aerotolerant anaerobes, that's another one. They can tolerate, but they are still anaerobes. They favor anaerobic conditions and microaerobics. So depending on their growth characteristics, we can classify them. So organic growth factors. What mentioned earlier, vitamins, amino acid, purines, pyrimidines, they are very much important to them. So after knowing the growth characteristics, growth requirements, now we'll move to a bit of clinical part, that is pathogen. You know, I think that is the bacteria that makes you sick. It's a late term, so but we'll say for the beginner, it's that make you sick. So there are multiple factors that cause sick. So now you know the disease chain. Now you know the disease through pathogen and opportunistic pathogens. Through pathogens, I said earlier, they are capable of causing disease for any individual, even immunocompetent, that is immunity-wise so well or healthy, or invariably they cause diseases to immunocompromised ones. So you know this is how they get the pathogens, direct or indirect modes. So this is the disease chain of infection, how it is happening. So nowadays about the direct contact, you all reluctant wearing face mask, gloves, so on. So it is with the direct contact, even the kissing, with the touch, handshake. So that's why I-borne is favored. So indirect contact by touching the deformities, doorknobs, handles, even pains, without knowing, we may share those things. Other important thing is they are harmless bacteria as well. So they are within our normal flora. Lactobacillus we use for industrial cheese production, yogurt, buttermilk, but at the same time they are in our body as well. Common pathogens. So they are true pathogens like E. coli, Salmonella, Listeria, Staphylococcus aureus, Streptococcus pyogenes. Likewise, there are a lot. So Salmonella, you can see Staphylococcus aureus, Campylobacter jejuni. We understand, we learn them. So coliform E. coli. So when you learn about bacteriology, it is always not only bacteriology, it's related to any subject. It's better to make a classification. So here there is a staining procedure. So we know it is gram, we can use gram stain. That is mainly gram positive and gram negative. So bacteria mainly classified as gram positive and gram negative. In the gram positives, depending on the shape, you know cocci. We can as a bacilli. Similarly, in the gram negatives, cocci, cocobacilli, they are another one, and bacilli. So cocci again, depending on, we can classify as cocci in chains, cocci in clusters. Likewise, cocci, gram negatives, and the diplococci. Cocobacilli, there are few organisms, and bacilli, short rods, long rods, like we can classify and make, you have to fill the gaps when the course is going through. So now we go for the proper bacteriology, that is Staphylococcus species. So Staphylococcus, so it's a family, Micrococcaceae, genus Staphylococcus. Mainly we classify using characteristic called coagulation. It's a bacterial characteristic we use to classify them as coagulation positive. It is coagulation reaction is there, coagulation positive. So main pathogen we have to know is Staphylococcus aureus. So its varieties, antibiotic resistant varieties, methicillin resistance. So all are in Staphylococcus aureus. Coagulation negative ones are, there are a few organisms, they are usually less pathogenic and they are part of our normal flora as a commensal in the skin. But they cause diseases like Staphylococcus epidermidis. Name itself implies where they reside. Staphylococcus saprophyticus, which cause urinary tract infection in healthy female. So it is, those all are true pathogens, but virulence wise, can't say it's low virulent, but less pathogenic, we'll see. And there are another variety called Micrococcus. So Micrococcus usually common contaminant in our laboratory setup. So you can see few more organisms about coagulation negative apart from epidermidis, saprophyticus, hemolyticus. There are few more. So it's Staphylococcus. What is the gram property? It is gram positive. What is the morphology? Cocci. How they arrange them? How they arrange in clusters. So it implies three-dimensional replication. So that's bunch of grapes-like appearance. So they are characteristic further, they are non-motile. So it implies no flagella there. No spore forming, they are non-spore forming. Non-encapsulated, no capsule. There are biochemical properties, they produce catalase. That's how we differentiate from Streptococcus. Staphylococcus are catalase positive. You can see these things in the practicals. In the oxidase negative, it's a glucose fermenter and it's a primary aerobic and facultative anaerobic may also there. So other characteristics, so this is a blood agar. These are the tiny colonies of Staphylococcus, and this is called bacitracin. It's a antibiotic extracted from other bacteria. So this Staphylococcus usually bacitracin resistant. Micrococcus other way. So Crohn agar contain peptone inhibited by media that has high bile salt concentration. So they are beta hemolytic most are. So another characteristic, they produce hemolysins, alpha hemolysins, beta hemolysins, them are like they, and there are hemolysins, they and they produce hemolysis. They are mainly beta hemolytic. When you learn about the Streptococcus, you may learn much about this character. For the sake of completion, I say hemolysis character we can see when we are taking the agar plate grown, when the microbes are grown there. When you look through, if you take an up and look through, if you can see the other side or transparent, it is termed beta hemolysis. If it is there are some greenish appearance, it termed as alpha hemolysis. It's mainly hydrogen peroxide or formation of oxyhemoglobin. Another thing is non-hemolytic or gamma hemolysis. So usually this cause beta hemolytic. This is beta hemolytic, but Streptococcus mainly depend on this character. We classify them as alpha, beta, and gamma. Here colony morphology, it is buttery looking, cream or white color. So you can see, appreciate it. It's a primary pathogen which habitat as a colonizer in the anterior nares, also in axilla, perineal area. So it's a mainly pathogen, I said. It mainly infects skin. It causes skin and soft tissue infection like cellulitis, erysipelas, leading to necrotizing fasciitis, also myositis, pyomyositis, and they can go further and cause bone infection, leading to osteomyelitis, septic arthritis, that is joint infection. Also, they can cause bacterial sepsis, and also they can cause bacteremia, that is bacteria in the blood. And also, they can produce endocarditis, meningitis, pneumonia. Anything is possible. And also, it's a common hospital-acquired infection. It's a pathogen because nowadays most of our hospital setup is contaminated and colonized with these pathogens. So when the initially patient is maybe admitted for the different cause, but when patient is there, when doing the cannulation, therapeutic options, contamination risk is high. Ultimately, patient may end up with hospital-acquired Staphylococcus infection. So we'll do a case-based discussion later on with Staphylococcus and Streptococcus. So mode of transmission, I said earlier, maybe endogenous in origin because patient may possess them in the anterior nares. So patient himself acquire the condition, or that is with the direct, or other ways, direct contact with the infected patient, or traumatic introduction during surgery, during trauma in the road traffic accident. It's high possibilities there. And with the surgical instruments, likewise, even the apron tie, so if organism is there, it could be the primary mode of transmission. So there are predisposing factors, conditions. If patient is having the chronic infections, having the devices like even the short-term venous cannula, central access long-term catheter, that is central line, or maybe hemodialysis line, even urinary catheter residing long-term indwelling devices, so high risk is there. I said this organism was a part of our normal flora. When skin injury is there, the organism is in the soft tissues or deeper tissues. So now it's a primary pathogen. And also it's immunoresponse defects. So once organism is there, it elaborate inflammation. So it's gram positive